Hi, Dr. Todd Sullivan from Nova Chiropractic and Acupuncture. We're back with my wife Nicole and our son Brady. He was born exactly 3 weeks ago from today. And so today what we're going to do is we're going to be discussing a postpartum visit and what often I see patients after the delivery for, and some other common issues that we see. So the most common thing we'll see obviously is lower back pain. That's still a common thing post-pregnancy wise. As your ligaments are tightening up, things can still shift out of alignment, and the muscles are also still really tight. In addition to that, now you're holding a little baby and bending over quite frequently to change them and to nurse them. Also, the other thing we see with nursing is the posture from nursing tends to put a lot of pressure on the upper back and neck area and causes a lot of neck pain. So Nicole, what would you say some of the common things that you've been experiencing since this is our third child and you've had some experience with this as far as postpartum discomfort-wise?
Yeah, I think everything that you said is what I'm experiencing right now. We had a natural birth, so the recovery overall was going well, but I'd say the majority of the discomfort is in my upper back because of nursing, and he's been sleeping on me a lot. And then also wearing him in the carrier, I've been experiencing some lower back pain and also some tightness in my glutes area. I'd say those are the 2 or 3 most common areas for me right now that I experience some discomfort.
Yeah, and we see that a lot with our patients postpartum wise. They'll have a lot of upper back neck tension from nursing and then also holding the baby. And we're going to do a separate video showing you how to correctly carry a car seat, because that's the other thing we'll see is new moms will come in with a lot of shoulder discomfort, which ties into the neck as well. But today what we're going to do is we're going to do an adjustment on her. We're going to work on her neck and upper back. We're also going to work on her lower back and hips to help loosen them up and get everything in the right alignment. So the first thing I'd like to do is let's have you sit facing that way for me. Okay, perfect. And let's have you just check your range of motion. Let's have you bring your chin down to your chest. Do you have any pain going forward?
Not too much.
Just tightness?
Just a little tightness.
And is it more up in this upper back area?
More so in the right region.
Right region, okay.
Yeah.
And then look up towards the ceiling. Any pain going back like that?
Yeah, just a little bit tightness.
Okay, look straight ahead. Turn your head to the right side. Good, and then let's have you go to the left side. Any pain or tightness there?
Definitely tightness.
And do you feel it on the right side or is it on the left side?
Both.
Okay. And so what we're going to do, she does have some tightness. You can see some limited range of motion, turning your head left and right there. A lot of that is from the upper back tension that she's been experiencing from nursing. So what we're going to do is we're going to work on the muscles up here first, and then we're going to do some adjustments for her upper back and neck area there. And then we'll assess her lower back as well. So the first treatment we're going to do for Nicole is we're going to do some dry needling in her upper back, okay? And the dry needling technique is a very effective technique for releasing some of the soft tissue tightness that she's experiencing. Very effective at getting rid of those knots or those tight points in the upper back region. A lot of times it's a very quick treatment. You'll basically experience a little muscle soreness when we're doing the treatment, but then it'll give you a lot of relief afterwards. So once we're done treating the muscle component, then we're going to address her upper back tightness and then her neck tightness. So dry needling is one technique we can utilize to release the tightness in her upper back and neck area. Another technique we often do in this area is called active release technique. It's almost like a sports massage technique to kind of help release some of the tension. And then the other technique we'll utilize is called Graston technique, which we use an instrument to help loosen up the muscle tightness. But today what we're going to do is we're going to do some dry needling in her upper back area and release some of the knots and trigger points she has going on. So the patient feels a little tap. That's me tapping the needle in. Good. There's one. There's the second spot. And what she feels when I hit those knots or trigger points is she feels the muscle do a little twitch, and then that's the release of that tissue in that area there. It's called a local twitch response. And then it also often will give her like a reproduction of some of the dull achiness, and you know that's the spot that the problem is. She felt a big twitch right there. So she has a lot of tightness even into the rhomboid area in her spine. And that's it. So now we're taking the needles out. We got the spots we wanted to treat. I'm going to do a couple other things on her upper back because, again, she is just generally tight through here. So we're going to use a massager here on her upper back area. This feels really comfortable. It's just like a vibration massage on the muscle tissue. Just helps to increase the blood flow to the area and help to loosen up some of the tension. Depending on the patient, sometimes postpartum-wise, we will see a patient 1 to 2 times a week for a couple weeks. And then as the muscles start to loosen up and as the ligaments in the spine start to get back to normal, then everything becomes more stable and then the patient's discharged. It often depends on how bad the pregnancy was, how much stress they had on their back during the pregnancy, or also what number they are, in their pregnancies. Have they had 3 other pregnancies? Sometimes they have some pre-existing stuff coming into the 3rd pregnancy, and then that leads to more issues in their back and spine. So it really can vary, but a lot of times it's just getting the patient out of pain, get them moving better, loosening up those tight muscles, and then we release them from care. So what we're going to do now is we're going to do a couple adjustments. We're going to do an adjustment for her thoracic spine here. Again, that's tight because of the nursing. Then we're going to do a couple adjustments for her neck. So what we're going to do is we're going to do an adjustment real gentle right up in this thoracic spine. And just take a deep breath in and blow it all the way out for me. There we go. Good release there. And let's have you flip over and go on your back now. Okay, so now we're going to do an adjustment for her cervical spine to help loosen up the tension in her neck. So what we're going to do for the first one is we are going to position her head a little rotated my way. There we go. And other area one to work on is right here. Good release there. Very tight. Okay, next what I would like to do is we're going to assess her hips because she's had a lot of hip discomfort from carrying the baby. So I'm going to have you lay on your left side and face away from me. And you're going to put your head on this pillow here. All right, and just start with your legs a little bit straight. There we go. Okay, I can already feel some trigger points and knots in her glute here. So for this, what we're going to do is we're going to do a technique called active release technique. So we're going to actively put the muscle through a range of motion, and as we're doing that, I'm going to contact the muscle and we're going to loosen up and elongate that tissue. So I'm going to have you bring your knee up towards your chest and then drop your foot down to the ground. Good. And then bring it back. And let's do a few more passes like that. Often patients describe this as like a hurts good, feels like you're getting into the area where the problem is and releasing that tension there. Feels a lot better in the range of motion, feels a lot better after we're done. Good. Let's do a few more. Good. And again. Good. Okay, stay there on your side. Now what we're going to do is we're going to do an adjustment for her joints and her low back. So for the adjustment, what we're going to do is we're going to bring this leg forward. I'm going to slide you a little this way. Straighten this leg. Again, this feels very comfortable for the mother, and it actually gives them a lot of pain relief. All the way out. Good. And face the other direction. We're going to do the same thing on this side. We're going to work on the soft tissue first in her glutes, and then we are going to do an adjustment. So let's have you bring your knee up and drop it down. Good. And bring it back and go again. Good. And again. Good. Couple more. Good. Okay. Let's do one more. Great. Okay, stay there on your side. We're going to do another adjustment. So what I'd like you to do is straighten that bottom leg, bend your top. Take a deep breath in, blow it all the way out. There we go. Perfect. Okay, let's have you sit up and face that direction for me now. Okay, so that just shows a typical treatment. We sometimes do more or less depending on the patient. One thing we also do in the office, if someone has had a cesarean section and they have a scar, often that can become really painful, especially as you're recovering with the little one. So there is a treatment we do called laser therapy where we can apply the laser over the scar area and it reduces the swelling and inflammation and helps accelerate the healing process. And we did that with our first because you had a C-section and it worked quite well at reducing the pain and swelling.
Yes, it definitely did wonders for my C-section scar.
Yeah, and then also after that, once the patient's out of pain, then I give them recommendations to help strengthen the core, which will help protect their low back as well. So if you're dealing with any postpartum low back pain or neck pain, give our office a call at 703-912-7822, or you can schedule online at novachirowellness.com.